people heard the terms mental health, right? Pretty much everybody's heard the words mental health before and have some general idea of what that is, but a lot of people are unable to define it or actually explain exactly what it is. So this video is just going to be about me explaining exactly what mental health is so that you have a better understanding. And then I also want to explain a little bit about how it affects new moms, or what mental health means when it comes to new moms. So let's just go ahead and kick things off with a little bit of trivia. So what do you think mental health is? Do you think it has to do with how you're doing psychologically, how you handle things emotionally, how you interact with people socially, or all of the above? Go ahead. Now, if you said all of the above, you're correct. So your mental health has to do with how you think, feel, and act in situations, right? So those situations could be stressful situations, it could be intimate situations, it could be just general social situations, but it's how you interact and feel and respond to those situations, right? So mental health is something that we all have to think about, right? It's something we all need to make sure we're taking care of, and it's good. But if that's true, and it is true, why do so many of us not focus on it or not worry about it as much as we do our physical health? You know, if something is wrong with our knee, we're going to make sure that we go ahead and take care of that knee. But when something's wrong with our brain or our mind, for some reason, that's not seen as important to people. So I really want to put this out there so that you guys realize that your mental health is just as important as your physical health. If you are not doing okay mentally, you cannot function at your peak, at your best level. It just can't happen. So there's different levels of mental health. And I think that's part of what people don't realize. When people think about mental health issues, they automatically typically go to like the extreme, right? Psychosis, schizophrenia, bipolar, like the most severe forms of mental health illnesses. However, there are other mental health illnesses that aren't as severe, right? There's there's anxieties and things of that nature that are still something we want to deal with, but they're not as extreme as the ones we see, on TV and movies when people, act crazy and do things like that, right? So keep in mind there's different levels to mental health illnesses. And, it's something that we all need to be making sure is in check for ourselves. So, signs to kind of start knowing if you are having difficulties and you may want to look more into them and try new tools or get help could be, the easiest way to notice is to pay attention to patterns. So if you keep ending up in situations where, you're having extreme difficulty with like getting your day started, with doing all the things you need to do on a regular basis, with engaging with people, with your emotions, you're always an emotional wreck, or you lack emotions, you don't feel how you think other people would feel in similar situations. Those may be warning signs that you have something going on, and it's a good time for you to go ahead and check it out and, reach out to either your physician or, do a Google search and find local therapists or local counselors in your neighborhood or in your area so that you can have a consultation with them and figure out if, what you're seeing is something you do need to get addressed. So mental health when it comes to new moms is a little bit different, right? Again, moms are just people, just like everybody else, but they experience something different that the average population doesn't after they give birth, and that is a significant drop in hormone levels. So with that, you're going to see differences in how you feel, how you interact, just how you move and engage on a regular day-to-day basis. And that's normal. However, it can become problematic or concerning if, you're having difficulties for an extended period of time, and we're talking, over a week. So, if 2-3 weeks later you're having these significant difficulties, functioning, getting out of bed, feeling happy, finding joy, being organized, things like that, then, it may be something more severe going on and definitely worth looking into and seeing if help is something that you need or seeing what kind of help would be best for you. There are two types of major mood conditions that happen after giving birth. And that can be what we call baby blues, and that could also be postpartum depression. Now, there are other mental health conditions that can arise after giving birth. However, these are just the two we're going to focus on right now. So with the baby blues, it's, you know, that drop in hormones is just going to affect you with, you know, there's nothing you really could do about that. You're going to feel fatigued. You know, you may be irritable, maybe moody, you know, things like that, right? And those can be easily taken care of by, you know, just getting sleep, getting water, drinking water, eating good, allowing people to help you, you know, things of that. And also with time, right? Because as you're adjusting to your new schedule, your new life, and, you know, you're going to get used to it as time goes by. However, if you're having symptoms that last a lot longer, like, you know, you're oversleeping, or you just have a really difficult time falling asleep, you're extremely irritable or angry, or you get aggressive, you have a hard time finding joy in things, like things that you even used to find joy in, like reading your favorite book or watching your favorite show, like those things no longer spark joy in you. You know, you or like have no appetite, right? Or you're overeating, things like that. Those are more serious signs and a good indication that something more serious than the baby blues is going on, especially if it's lasting for more than 2 weeks. So with things like that, you definitely want to go ahead and reach out and get some kind of support so that you can get back to being you, right? So that you can get back to enjoying your life and not have to deal with these difficulties for an extended period of time. So there are some like what we call risk factors, right, that can make certain women more susceptible to postpartum depression. And that's if you previously had mental health conditions, so you were diagnosed with depression, bipolar, you know, anxiety disorder, something like that in the past. You have family members who have been diagnosed with some kind of mental health condition. You're dealing with like extremely stressful situations, so like difficulties with your spouse or your partner, financial difficulties, just any high stress, things like that can, you know, be indicators or can make it a lot easier for you to fall into a depression. So, you know, if you have any of those things going on, that's also a good reason to go ahead and reach out for help before things get bad, so that you can, you know, develop good coping skills and you can work through it, or get on medication, or do talk therapy, or, you know, whatever seems to be the best fit for you and your situation. Let's see, is there anything else I want to touch on? I really also just want to say that, you know, mental health difficulties as a new mom and just feeling extremely overwhelmed or being depressed or being anxious, any of that, none of that means that anything is wrong with you. All right, this is nothing you asked for. This is nothing you created. It's just something that naturally happens, again, with the dip in hormones. It's just part of life and part of the cycle. And I really want people to stop making moms feel bad about having these situations and about being depressed or about having mental health issues, or making them feel less than, because that's just ridiculous. Again, anyone can have mental health issues, even someone that's never had any mental health issues, or no one that has no genetic predisposition or anything like that. It can happen to anyone, all right? And it doesn't make you weak, all right? So go ahead and ask for the help. Go ahead and reach out and allow yourself to put your best foot forward, your best self forward, so that you can be there for yourself and you can be there for your child. That's the best advice I can give. And I'm hoping that by doing these videos, I'm going to help reduce some of the stigma and normalize this, because it really is that normal. All right, let me know if you have any questions. I would love to hear your feedback. If you've experienced a situation like this, your thoughts, or anything else you want more clarity on from me. I'm going to be posting more videos like this, so I want to make it helpful to you. Now, if you found this video helpful or informative, please give me a thumbs up and share this video with anyone that you know that may find it helpful as well.